Newsflash, filler isn't a magic eraser. In this Myth-Busting Monday, I'll show you when fillers are brilliant, but also show you when surgery saves the day. So let's do a quick test here. I want you to grab a mirror. You go in a room without too much natural light. Put your chin down and look at the mirror. This way, you're exaggerating the amount of eyelid aging that's present. When you go chin down and look at a mirror, you're exaggerating your fat prolapse because they're coming out and becoming more obvious, and you're also identifying how hollow you are. This gives us an idea exactly what extent of issues are going on, whether you have true fat prolapse with or without hollowing, or if it's truly hollowing. If you truly have hollowing and you look up, you should not see these prominent fat bags. That's what I like to do in my office too when I examine you. That's a telltale sign of figuring out which road am I going on. Am I going to be going on a road to rejuvenating your eyes with under eye fillers, for instance, or when I'm going on that road for a blepharoplasty with fat repositioning, for instance. Bags are bulging or prominent lower lid fat pockets. Fillers do not help with that. The fix for that is a blepharoplasty surgery that directly addresses the problem, which is the prolapse fat pockets, which will need to be debulked. And then part of those fat pockets will then be repositioned to improving the underlying hollowing, which usually occurs in most patients that have eyelid aging. Once the fat has been adequately repositioned and the extra fat has been reduced, so there's a nice, beautiful improvement. Well, before the surgery, the patient's fat was bulged anteriorly, and then you have that hollowing causing sort of backwards S. After the surgery, you're aiming for a flat result. The fat excess has been debulked and the fat repositioning has helped improve the hollowing. Beautiful result is topped off with addressing the skin texture changes. That can be done with a multiple of options, which I generally resort to either using a CO2 laser, chemical peel, or microneedling to improve the skin texture. Now, if a patient truly has skin laxity, excess skin, that's when a skin pinch will also be integrated. In those particular cases, I may also still consider overall improvement with the skin texture with either a CO2 laser or a chemical peel or microneedling. Get your free virtual assessment in the link in our bio. Hit follow for more myth-busting secrets.